Good evening and welcome to the November 2025 edition of Glaucoma Australia's live Q&A webinar series, which is proudly brought to you by our long-standing and generous supporters, Glaucos. My name is Val Toswell and I'm one of the 3 orthoptist patient educators at Glaucoma Australia, as well as your host for this evening. Before I introduce tonight's speakers, I would like to acknowledge the traditional custodians of the lands, skies and seas in which we collectively gather for tonight's event. I pay my respects to our elders past and present, along with their emerging leaders. Well, tonight's topic is one that brings many questions to our orthoptists. Glaucoma and driving, your questions answered. Our speakers welcome your questions as we go along. However, they're not able to provide direct responses for individual cases as they're not aware of personal test results, medical history, general health, etc. To present this live webinar is our dynamic duo, Drs. David Wechsler and Neil Sharma. They're both Sydney-based ophthalmologists. Dr. David Wechsler trained at Sydney Eye Hospital and then underwent further training specifically in glaucoma at Manchester Royal Eye Hospital in the UK. He's been working in both public and private practice since 2007, and he's the director of Burwood Eye Clinic in Sydney. He's involved in registrar teaching and training, and David's an examiner for the Royal Australian and New Zealand College of Ophthalmologists, and since 2014, he's been a visiting specialist to the Royal Darwin Hospital. He has experience in managing patients from early stages right up to advanced glaucoma, and he's been working with GA in providing educational activities since 2009. And we're very proud to say that David recently joined our board as a non-executive director. He's also contributed to the scientific literature, specifically in the field of glaucoma surgery, and he reviews articles for international journals. Dr. Neil Sharma also trained at Sydney Eye Hospital and underwent subspecialty training in medical retinal diseases at Cambridge University Hospital's NHS Trust in the UK. He commenced as a staff specialist ophthalmologist at Sydney's Westmead Hospital in 2013. Privately, he works at eye and retina specialists in Zetland in Sydney, and he's been involved, in registrar teaching, and he's a clinical senior lecturer at the University of Sydney and University of Wollongong. Neil is interested in raising public awareness of eye diseases and eye health, and you may recognise his voice because he's a regular invited guest on 2GB Radio in Sydney and 4BC Radio in Brisbane. Proudly, Neil was awarded the 2020 Safe Work New South Wales Award for Work, Health and Safety Response to the COVID-19 pandemic and was the 2021 regional winner in the City of Sydney for innovation in the New South Wales Business Awards. Neil has a particular interest in vision disorders and driving. So tonight we're in the hands of 2 very esteemed ophthalmologists, so let's get started. Thank you, David and Neil.
Okay, so I'm up first. Thank you for that generous introduction, Valerie, and it's a pleasure to be with you all tonight. And we've got some questions in already, so please keep them coming. So I've given a few talks on glaucoma and driving before, but I'd like to just start things off tonight with going over some very basics for those who haven't heard this information before. So my talk is broken up into these sections, these questions. Well, firstly, what are the issues with glaucoma and driving? What are the rules in Australia we need to be aware of? And then finally, how is this assessed? And Neil's going to talk a bit more about that also. So firstly, what are the issues? Being really simple about this, glaucoma leads to visual field loss, and this field loss is usually asymptomatic. And the effect of that is that can impair seeing things or reacting to things when we drive. Now, this photo is shown often, but I think it's worth showing again for those who haven't seen it. If there's a typical scene, this is actually from the Netherlands, I believe, or Belgium, somewhere like that, but equally applies to Australia, that when we've got glaucoma, we might think we're seeing the world, but there'll be bits that are missing and our brain fills in the gaps. It's not like there's black spots in the vision that the patient or the person with glaucoma actually sees. Their brain fills in the gaps and shows them an intact view of the world, but just certain things within that can be missing. Now, there's an extensive literature on the topic. Just recently, there was a meta-analysis published in the Journal of Glaucoma, which I've summarized the main findings there. But to make a complex area relatively straightforward, the more field loss you have, the more likely the increased risk of the collision there is. Okay. Now, when it comes to the guidelines, which we'll talk about in a minute, a line has to be drawn somewhere. And sometimes it's not so clear cut where we draw the line. But the various jurisdictions have had to make a decision where they've said at this point, the risk of a collision becomes unacceptable and a risk to public safety. But what we do know, and what's beyond doubt, is that if people have glaucoma and if they then develop visual field loss, as that gets worse, then the risk of having a collision goes up because of these issues with the blind spots and the impairment of the vision and reacting to things. It's not just what you yourself are doing, it's also reacting to what else can happen on the road. So when it comes to testing, those of you with glaucoma who've been to see an ophthalmologist or an optometrist will be very familiar with visual field tests. So firstly, there's the visual field test that we do when we're assessing glaucoma, and that's testing each eye separately. So we cover one eye and then get you to do the machine on the other eye. And that's to look at that one eye over time if that's getting worse. But then there's the same machine on a different setting can be done with both eyes open, and that's what we're doing for a driving assessment. So if I show you these here, there's each eye being tested there. The one on the left shows extensive visual field loss in one eye, and the one on the right shows a more modest field loss. And that's the sort of printout that we look at when we're assessing each eye. So if you're coming just for a regular appointment, that's the sort of field test that they're going to do. But when you actually have a driving assessment done, or if you need some paperwork done for the driving license authority in the state that you're in, we need to do another test, which is what we call the binocular estimate test. And so that's the lower one that I've shown there. It's testing a larger degrees of the visual field. And that when you superimpose those two upper fields there, you can see there's areas within it where there'll be points that aren't seen. But if the fields in the two separate eyes are in corresponding areas, that'll translate into an actual blind spot in the vision. Whereas let's say you're missing the top half of the field in one eye and the bottom half in the other eye, if you put those two eyes together, your actual binocular field will be actually intact and almost normal. So the role of overlapping field defects is very important in glaucoma. So just be aware of the different types of visual field tests if you find yourself having to do them more than once at various appointments. So what are the rules? So in Australia, and this applies to all the states, in Australia, you need a visual acuity of 6/12 or better with both eyes open. So you don't have to read the bottom of the chart, but you have to read a fair way down, as I've indicated there. Then separate to this is the visual field criteria, and we need a horizontal extent of 110 degrees, and that's with both eyes open. Now I've drawn on that visual field test there in the box, that square rectangular box, that's roughly the amount of peripheral horizontal extent of the visual field you need. There's another rule about the visual field, which is that you can't have what is termed a significant scotoma within the central 20 degrees. So this is defined as a cluster of 4 or more points within that central area. There's another criteria, and we've already had a question about this tonight, about not having double vision. So I haven't dwelt on this because generally in glaucoma, double vision is not a common thing, but there are other eye conditions that can cause double vision. But there are rules about how much double vision you're allowed to have as well. But for all intents and purposes, you have to have a good extent of field where you don't experience double vision. So this is assessed. There's an assessing fitness to drive guidelines, which is put out by Austroads, and this is a national framework. So it applies to every state and territory in New South Wales. However, the individual states administered this separately because when you look at your license, it comes from your local state government. Now, it's important for all of you to remember that the individual clinicians, the doctors that you're seeing, they work to these guidelines. It's not what the doctor thinks. The doctor has to look at these rules and then apply them as they see based on the findings in your examination. And Neil's going to talk a little bit about the assessment further. Some areas of confusion that I see in my practice that always comes up, and it's a relatively basic thing, but it's worth making the point, is that there's a difference between what we call the visual acuity, which is the reading on the chart, those charts that you've all seen, and the visual field, which is testing the peripheral vision. The visual acuity is only from the tiny central part of the visual field. So someone with glaucoma, for example, could have extensive visual field loss, some issues with their peripheral vision, but they could still have perfect visual acuity on the what we call the Snellen chart. And so it's important to remember that you could read the chart perfectly, but there could still be an issue there with the peripheral vision that means that you don't satisfy the requirements based on the guidelines. I've already mentioned there are different types of visual field tests, so just be aware and be sympathetic to the doctors if they're asking you to do it more than once, and that's because they might be testing something different with the same machine that they need to demonstrate for the driver's license authority. The other issue is that whether someone is what we call monocular or binocular. So most people are binocular, but if someone has lost one eye for whatever reason or born with one eye that doesn't work so well, the field requirement can be stricter for monocular individuals. The other thing that sometimes comes up is people might be on a private or a commercial driver's license, and the standards are different for these two sets of license. So I'm just going to wrap up now and hand over to Neil, but I just wanted to sort of emphasize again that the evidence base is complicated. What we do know is that the worse your vision is, the more the increased risk of having a problem on the roads is. And so what's happened is the Driver's License Authority have had to look at all that and have to draw a line in the sand somewhere to make it feasible when we're trying to assess people about whether they can safely drive on our roads or not. And in doing this, it's a balance between the personal autonomy and the public safety. For those of us at the coalface, we hate having to do this and be in the position where we're saying to people, you know, you might have to give up your license or consider not driving. It's a very difficult part of the work we do. But I think what this reflects is that driving is a highly regulated activity. I mean, we don't really think about it once we've got our license, but if you think about everything you have to go through to get your license, you have to study, you have to do the test, you have to do all this thing. I mean, and we regulate other things with driving. And so really this is no different. So this is just one aspect that affects people with glaucoma or any visual problem for that matter, and something to be aware about when you're having treatment for this condition. So with that, I will hand over to Neil.
Great. Thanks, Val. Thanks, David, for that. So just to continue on what David has just discussed, the importance of vision while driving is something that can be overlooked. On a clear, bright day in good driving conditions, things may seem easy, but when you're given a license, you need to be able to see road signs, line markings, pedestrians, other vehicles, and even unexpected objects that suddenly may come into your vision, and have enough time to react and to avoid collision. And this needs to be able to be done under varying light and weather conditions. And it's important that drivers have peripheral vision that's appropriate to monitor objects and identify possible threats and adapt to them. There was a recent study from Western Australia which looked at binocular visual field loss, and it showed that if that was in both eyes, there was an increased odds of a car crash by almost 84%. And so that was just a sobering statistic based on real life data from WA. As David also sort of mentioned, fitness to drive is a difficult area for everyone involved, for patients, for doctors, and even for families, because we all recognize that driving is usually very important for a person's independence, social and mental well-being, and losing a license can have really profound effects. So it is something that is taken seriously by everyone involved. Discussing these issues can certainly cause anxiety amongst patients, amongst clinicians, and even family members. And there are cases where family members may be concerned about a relative and report them directly to the driving authority, or they may sort of talk to the doctor privately and indicate a concern that they might have noticed as well. But the other issue is that sometimes disagreements can interfere with the doctor-patient relationship. And what is of concern is if that sort of interferes with the underlying treatment of the glaucoma or the eye condition that is involved. And it's important to realize that everyone has their own individual roles and responsibilities in this area. As we said, it's an area that is governed by fairly clearly defined guidelines. We're currently on the 2022 edition of the National Assessing Fitness to Drive guidelines, and these guidelines are typically reviewed every 5 to 6 years and updated as the evidence base changes, technology develops, and we learn more about different areas of medical conditions and the effect on driving. So it is something that is regularly updated and reviewed, and typically every 5 or 6 years has been the average in recent times. And as I was mentioning, it's important to realize that there are key responsibilities that someone has as the driver, we have as health professionals, and also the role of the driving license authority. So as a driver, it's important to realize that you have the responsibility to report to the licensing authority as soon as possible any long-term injury or medical condition that may affect the ability to drive safely. If you've already reported it and there's been a change to the health or treatment, this also needs to be updated as soon as possible. And the guidelines do specifically mention glaucoma as a condition that there is a duty to notify at the time of diagnosis. As a health professional, our role is to assess the person's fitness to drive and basing it on the clinical information that we have obtained and then comparing it to the Austroads national guidelines. It's also important the health professionals remind drivers of their responsibility to report their condition. And interestingly, in Australia, only South Australia and Northern Territory have a mandatory reporting for health professionals. If the health professional has a reasonable belief that a person is unfit to be licensed and continuing to drive might endanger public safety. In the other states and territory, there's no mandatory requirement for health professionals. It's only South Australia and Northern Territory that have that legal obligation. Ultimately, the driving licensing authority that makes the final decision. And in the AFTD guidelines, it specifically says that medical practitioners and other clinicians do not have the legal authority to restrict, reinstate, or apply conditions to a patient's driving license. And this can only be done by the licensing authority. So it's ultimately the clinician's role to make an assessment, give an opinion, and submit the objective evidence. And then the licensing authority takes that information along with other information it may have access to and then make a decision. It's important to realize, though, if your doctor has advised you not to drive, then continuing to do so against that medical advice may have serious legal insurance consequences. So it's not something that unfortunately patients should put their sort of head in the sand and ignore if their license has been deemed to be unsafe. But there are processes to go through. And then finally, the key responsibilities for the licensing authorities is to make all decisions regarding the licensing of drivers. The driving licensing authority, as I said, will consider reports provided by health professionals, but also from police, members of the public, sometimes it may be family members, as well as looking at crash involvement and driving histories to assess whether or not someone is suited to drive. And for conditional licenses, the licensing authority, again, takes all the relevant information to make the final decision whether a conditional license may be issued or not. And every state and territory has its own licensing authority that does things slightly differently, and each driver has to sort of abide by their local rules. So that's a summary of what I wanted to present. I think we're now opening it up for questions.
Yeah, thank you both, David and Neil. I think we don't really realise that driving is such an automated and integral part of what we do every day. So it's really important to go over the impact that glaucoma can have on our ability to drive. So thank you for that. David, I really appreciate you going over the difference between visual acuity and visual fields, because that can be quite confusing because you can see quite well, but the difference is the visual side. And Neil, thank you for acknowledging that when you lose your driver's license, it is a profound loss, and everything changes with that. So thank you for acknowledging that. We do have some questions, and we'll start with those, but please put your questions in the comments as we go along, and we'll answer them whilst we've got Neil and David with us. So the first question that we have has come through. What are the guidelines around a restricted or conditional license?
Okay. Actually, might start off and then ask Neil a question about this as well. I mean, I find this terminology quite confusing myself. So firstly, a conditional license. Conditional license can mean anything. For example, if someone has to wear glasses for driving, that's a condition on their license. And I believe in New South Wales, at least anyone over the age of 75, because they need annual checkups, they're on a conditional license. But it doesn't mean that there's necessarily any restrictions on them. So Neil mentioned notifying someone you have glaucoma, notifying the driver's license authority that you have glaucoma. So even if you're under 75 and you've been diagnosed and you have significant glaucoma, if you notify them, then that will just be noted on your license, and it becomes a conditional license where you have to have updates and reports done on it. But it doesn't necessarily mean there's any restrictions. If you don't meet the criteria, that's when they look at the restrictions on the license. So maybe, Neil, if you have anything to add to that about the difference between conditional and restrictions, and then about how we go about getting the restrictions or ascertaining that.
Yeah. So essentially, an unconditional license is someone who has no underlying, in this sort of talking about eye conditions specifically rather than general medical conditions, but has no sort of eye pathology, any eye disease, has normal vision, and has more than 110 degrees of normal visual acuity. So their central vision is good, their peripheral vision meets the requirements, and then they will qualify for what's termed an unconditional license. If they have a history of eye disease that may affect their driving, then they will be issued a conditional license, provided they meet the criteria. But there may often be no restrictions on that, and they're free to drive as normal. But there may, for example, be, rather than a 5-year license, it may be every 3 years or every 2 years, depending on the protocol and underlying condition that they have. So that varies from individual, but essentially they can drive normally without restriction. Where someone doesn't quite meet the requirements for an unconditional license, so say, for example, they do have a condition such as glaucoma that is impacting their peripheral vision, but it's still relatively good. If they're just under the requirement, then they may be issued a conditional license with some restrictions. And those restrictions may include things like a kilometre radius restriction, where they can drive a certain distance from their home. And that reflects that they're more likely to be safe on familiar streets and in familiar areas. Or it may say no nighttime driving, for example, recognising that nighttime driving is generally more hazardous in someone with visual field defects than daytime driving. So that sort of depends on each individual case on how bad the glaucoma may be. If they don't quite meet the criteria but are close enough that they should be given an opportunity to still be able to go to the local shops, to go to their doctors and do sort of some of the basic things which maintains their independence. So it recognises there is a grey area, and it tries to sort of compensate for that grey area, even if they don't meet the unconditional requirements.
Yeah.
Just if I can add one other thing, I guess the premise of the question might be, what are the guide in terms of what are the guidelines for that? It's a little bit less clear. So what I went through was what are the guidelines for an unconditional license. So if you're 612 or better, if you've got the 110, if you're less than that, that's when it's a little bit less clear cut, and it's a case of trying to put in what the vision is and put this in, and then seeing what is deemed acceptable in terms of an appropriate restriction. But what I sometimes say to patients is that we're trying to show that we're taking steps to mitigate the effects on the driving of the visual impairment. But it's not in black and white, as in like, oh, if you're below it by this much, then you get this much restrictions. Would that be a fair comment?
Correct. I think the guidelines sort of do acknowledge that they will look at things like past driving record, medical comorbidities, ability to scan and signs of visual adaptation, and then also where the patient lives. If they live in a country area, they may need to drive a longer distance on still familiar roads, but to get to their local shops or their doctor, where someone in the city may not have the same distance requirement. So it is individualized depending on each individual circumstance. It's not a one-size-fits-all where these are the requirements, but there is a minimum of, say, 90 degrees for a conditional license to be considered, and below that, then it's generally not acceptable, is generally the guidelines.
Great. Thank you. Following on from that, it lends itself as another question: do I need to report my glaucoma to the licensing authority? Now, Neil, you've answered that one already, but you mentioned it needs to be reported at the time of diagnosis. But what if there's no change from glaucoma? Do you still need to report that?
Yes, so it's an interesting one. Certainly the guidelines specify once the condition is diagnosed, it should be reported to the licensing authority. What they will then usually tend to do is to seek further information from the specialist or the optometrist, and maybe a copy of the visual fields or information. And if there's no visual field loss and it's still very early, then there may be no change to the licensing and it may continue. But they may sort of just monitor it a little bit more carefully. But theoretically, it does specifically say once diagnosed, then it should be reported and notified. And then depending if it's very early with no changes, a patient may not have any additional sort of restrictions placed on them if everything is safe to continue driving.
Okay, thank you. And again, flowing on, the next question: how often will I need to be reviewed for driving clearance? So once it's been reported, how frequently do you need to be reviewed, or is it just whenever your license is up for renewal?
So with this one, it depends on, again, the state of the glaucoma and how advanced it is. If someone has quite advanced glaucoma and is being issued a conditional license, then generally they may be asked to provide annual updates or do visual field testing every year to ensure that they remain safe. Whereas if it's very early glaucoma with very little or no field defect, then it may just be every 3 or 5 years as they would otherwise need to do. So it just depends on how advanced the glaucoma is. And the RTA, or in New South Wales, sort of Transport for New South Wales, has its own protocols of how often to do these testing depending on the condition. But generally it depends on how advanced or mild a disease process may be.
And so just going back to reporting, what if you're a glaucoma suspect? Does that come into play?
A glaucoma suspect, sort of as a clinician, doesn't technically have glaucoma, and we have a lot of patients who are glaucoma suspects, but I wouldn't classify them as glaucoma. So at that stage, it wouldn't need to be notified.
Thank you. So we've got a fabulous question from iPsychology. What are the avenues in place to ensure that optometrists and ophthalmologists remain current in their knowledge about OSTROAD guidelines? Really good question.
That is a good question. Look, one thing that happens is that because we're seeing the patients that are coming with these assessments, it's sort of a feedback loop for us, because we're interacting with the driver's license authority, and then we sort of go back to the guidelines and that sort of thing. In terms of education, I mean, bulletins are put out when it's come out, when the guidelines are updated. I guess there's always room for more education. I got to say that this is something Neil and I have talked about before, certainly in the education of ophthalmology. I'm not sure about optometry. There's probably room for more education of people during training. It is definitely covered during training, but some of these nuances that we're talking about tonight, they only come out when you've been in practice for a while and you see these things. I mean, every ophthalmologist and optometrist, when they've sort of unleashed on the public, will know basically what the guidelines are. But, how you apply that in practice and how you actually counsel patients, that's something that evolves over time. But as for updating when there's changes and things, there is sort of updates and this sort of thing, but I guess there's always room for improvement in communication. Do you have any thoughts on that, Neil?
Yeah, no, as you say, I mean, certainly I'm aware, as you say, that Optometry Australia puts out a notice and emails sort of quite widely clinicians what the changes to the last guidelines might have been when there are changes, and highlights those sort of quite clearly. But for some of the more nuanced questions, there's like everything, there's always room for more education and more learning, but it's something that I think is covered during registrar training for ophthalmologists, and I think most people are aware of the latest guidelines.
And within orthoptics as well, I think everyone's abreast, because we're at the front doing the visual field tests, etc. And we do get asked questions as well. So I think everyone within the eye care sector is abreast of.
Actually, I think I learned a lot from the orthoptists with the visual fields. It'd be like, this person needs an estimate. I'm like, yeah, that would be great. That would be
do that. Yes.
That was my introduction to it. Yeah.
Now, apologies, but in the essence of time, we need to wrap it up there. There are more questions, and if anyone has questions they would like to submit, please send them to glaucoma@glaucoma.org.au. We will forward them on to Neil and David for their response. Once again, thank you to David and Neil for this terrific and really important presentation. And thank you to everyone who joined this live webinar tonight. The webinar will be available on Glaucoma Australia's YouTube channel, and that's easily accessed at the bottom of the GA website homepage. So enjoy the rest of your evening, and thank you for joining. Thank you.
Thanks, Val.
Thanks, everyone. Thank you.
Ta.